Good afternoon, everyone, and welcome to this afternoon's session of the Carer Knowledge Exchange Incubator event for 2024. My name's Elena Katrakis. I'm the CEO at Carers New South Wales, which leads the Carer Knowledge Exchange in partnership with the Institute for Public Policy and Governance at UTS. I'd like to start off this afternoon's session by acknowledging the traditional custodians of the land on which we're meeting today. For me, in North Sydney, here it's the Gorigal people of the Eora Nation, and I'd also like to acknowledge the lands from where all of our participants and attendees are coming from today. I'd also like to extend my respects to Elders past and present and to all First Nations people, and particularly noting the unique experiences of First Nations carers. So across this week, we've already heard from a wide range of contributors about different aspects of sustainability and caring. So we haven't focused on really that. It's not about sustaining the caring role. It's really about looking at sustainability and caring from a range of different perspectives. So on Tuesday, we heard about innovative, carer-led, culturally and responsive approaches to sustaining carer support and, importantly, sustaining carer wellbeing. Yesterday, the focus was on the financial sustainability for carers, which is super important, particularly in these cost of living crisis times that we're in at the moment. And so today, this third and final day of this year's Research Incubator, we're going to focus on sustainable carer policy and the policy environment, which is driven by expert input from researchers, policymakers, practitioners, and importantly, from carers as well. So our session this afternoon is an interactive consultation. We're structuring it that way to inform the many areas of developing carer-related policy in Australia, much of which is, there's very many things going on at the moment. So similar to yesterday afternoon's workshop, for those who participated in that, we're going to seek your input through some questions on Mentimeter. And you'll also have some breakout room discussion where we can actually have a chance to hear from everybody this afternoon. So for now, if everyone can turn off their videos and microphones, that would be appreciated, and we'll move into this part of the session. So just as a bit of background, at the moment and in the past year or so, we've seen extensive review and reform of policy and legislation affecting carers. Earlier this year, the final report on last year's parliamentary inquiry into the recognition of unpaid carers recommended a number of amendments to Australia's Commonwealth Carer Recognition Act 2010, along with recommendations about carer support services and the role of the new National Carer Strategy, which was announced by the Minister for Social Services in October 2023. So at the same time as all of that, we've also got new legislation being developed to govern the design and delivery of the aged care service sector and also disability services across Australia. So building on the findings of multiple reviews and royal commissions that have identified necessary legislative change. So these new laws will affect family and friend carers, and it's really important that those of us that are involved in the space, that are researching in the space, that are part of this environment, that we feed into those legislative reforms so that they're meaningful and really have a good and positive impact for carers. So while all of that's going on, we're also in the midst of a review by the Fair Work Commission of the modern award provisions relating to work and care, following on from a number of inquiries in the past 2 years into the status of flexible work and leave entitlements available to carers. And only a few weeks ago, the federal government announced changes to the rules around working, studying and volunteering while receiving carer payment, which was very much welcomed and something that the Carer Network and many have been advocating for a very long time. So as the peak non-government organisation for all carers in New South Wales, and also as a member of Carers Australia and a key part of the National Carer Network, Carers New South Wales contributes extensively to all of these government reviews, inquiries and reforms that affect carers. Our responses, as many of you will know, are strongly evidence-based, drawing on the findings of our National Carer Survey and on consultations with carers and other stakeholders, making sure that we've got that lived experience as part of that discussion and part of that consultation and part of that informing what we do. Carers New South Wales input is, often highly regarded and is often cited in government reports and taken on board by decision makers. But we're also aware that because there's so much happening, there's quite a high demand on carers in their need to respond to these things because there's so much going on. So this afternoon session is our way of streamlining our engagement with carers and stakeholders to inform a number of current and upcoming opportunities, including our responses on new NDIS and aged care legislation, which I mentioned before, the new National Carer Strategy, and Carers New South Wales pre-budget submission to New South Wales Government, which we do every year. So today's session aims to inform this work. So it'll be, a few touch points, a few questions, a few opportunities to feed in at sort of a high level as to what people are feeling, what issues they're seeing, and what's important to them. So we're going to start by engaging you in a few questions using Mentimeter, a tool that you can access on any device that has internet. You might want to use the device that you're watching this on or on a separate device. So you'll see now a website and a code on the screen and in the chat. You just need to follow those instructions to open it up and you should be able to respond to the first question. So I'll just give everyone just a couple of minutes just to access that. And then we'll move into the questions. So our first question today is, how are you currently feeling about the direction of carer-related policy? Quite a few mixed emotions there. Not confident, hopeful, positive, cautious, concerned, exhausted. I think there's a lot of people that are feeling exhausted with everything that's going on at the moment. So we can see there's left out. So we want to make sure that people feel included as part of what we're doing. So we might move on to the second question. And this is just a quick sort of yes, no answer. Have you participated in a government consultation or provided feedback to government to inform policies or programs in the past 12 months? You can see there the mix there, a number of people have. And a few things coming through the chat there as well. So the next question is, have you experienced any challenges or barriers to participating? So again, being time poor, busy, not aware of opportunities, feeling that sometimes it's a bit tokenistic, all themes and things that we've heard. And we also want to make sure that people feel engaged in these consultations in a positive way. Not accessible and sometimes having to travel. So again, that access issue. Yep, so active involvement. So again, a lot of comments there around feeling that sometimes it feels a bit tokenistic. Okay, might go on to the next question. Which of the following policy areas are your biggest priorities? So they include how the term carer is used and defined, access to carer support and services, including respite, financial support and longer-term financial security, employment rights and entitlements for carers, service navigation and advocacy, aged care and disability reform, secure and affordable housing, carer rights and recognition. So again, you can choose your top three and then you can see where the focus is on the columns on the screen at the moment. So they're carer rights and recognition, financial support and long-term financial security, and employment rights and entitlements. Currently the top three coming through there, but also the others fairly evenly spread. So that's some really good, I think, starting point for thoughts around the key issues and focus areas in the policy environment. A few extra ones coming through the chat: service navigation and advocacy, carers and employment's rights and recognition. So again, those top kind of three areas maintaining there. Another one for secure and affordable housing, access to carer support, another one for financial support. Okay, so again, thank you to everyone for sharing your responses there. We're going to move now into breakout rooms so that we can discuss in a bit more depth some of those emerging issues and areas of carer policy in greater depth. So the breakout rooms will be automatically allocated. You just need to accept the invitation when it pops up on your screen, and we'll be in the breakout rooms for about 25 minutes. And then we'll return to the main group for a wrap up and a feedback from each of the breakout room facilitators. Okay, so just everyone coming back in from the breakout rooms, and we're now going to hear back just briefly from some of the key points from the breakout room facilitator. So our first breakout room to report back is room 1, which the facilitator was Sarah Judd Lamb.
So yes, in breakout room 1, we had a really great chat about carer recognition, carer rights and recognition. And actually half of our breakout room were in my breakout room yesterday, which also was a very interesting build on that discussion. So the main issues we discussed were a lack of awareness that there are rights, a lack of inclusion and recognition of expertise in clinical environments, limited rights in mainstream service settings like education and in the broader community and in the workplace, and also too much reliance on carers having to advocate for themselves and sometimes kind of banging their heads against a brick wall. And also just the lack of visibility of carers as needing support in their own right. And with solutions, we mainly talked about advocacy, and what we talked about there was actually very similar to what came up from the February webinar, where we talked about carers' differing capacity to participate in advocacy, and that they need to be recognised and remunerated for that, and or have support to do it, because a lot of carers just don't have the time or the skills or the confidence to be able to fight against systems. And so we talked about that. We also talked about recognising the health and mental health impacts of caring, and sort of selling to policymakers a broader understanding of both the value and the costs of caring, so that those things can be addressed. Look, I could say more, but I guess the final thing would be that there's a few formal mechanisms and strategies that we can look at, such as the new National Carer Strategy, some ideas around better representation on committees and training, and something like a Carers Commission that could look at better representing carers' views at that top level. But ultimately, there was a comment that was really useful, I thought, which was that we need to shift the public's, or we need to shift the understanding of caring as a private responsibility to as a public responsibility.
Yeah.
And that's where that visibility comes in. So that was our group.
Great. Yeah, and I think that that quote's a good one from that around that public responsibility, and I suppose that more focus publicly on caring. So it's not just something that happens behind closed doors, that the broader community is aware of that. So thank you for that, and thank you for all of the participants in breakout room 1. We'll move to the report back from room 2. So Melissa Docker. Thanks, Mel.
Our room talked about employment rights and entitlements for carers. We had a great discussion, and the people in our room kindly shared some of their own personal experience in employment. We identified that while there's a number of existing employment rights and entitlements, there are often also a number of barriers to actually accessing these, including awareness and understanding of what's available by carers as well as employers, that sometimes they're not fit for purpose and they don't apply to carers in some roles, such as casual roles. So there are a lot of challenges to accessing these. In terms of solutions, I think the key thing that came through across our discussion was the need for greater education for employers and managers around who carers are, what they're entitled to, and how to support them in this process, and really addressing some of those preconceived ideas that they may have or stigma that might arise from people disclosing, as well as also building the understanding and awareness of carers and the confidence for them to kind of access those rights and entitlements where they may exist. So knowing what they are and being confident about accessing them.
Great. Certainly some things there. I mean, obviously for the Carers and Employers program, where there is an education component, obviously hoping to build on that and expand that would be one way, but some good feedback there. Room 3 is Lucas. So I'll hand over to Lucas to feedback on the discussion in breakout room 3.
Hi. So we discussed better access to carer services, including respite. The discussion really centered around, on one hand, the flexibility of accessing services, and that services need to better understand and better recognize caring roles and their impact, and especially in individual circumstances that do not fit into sort of cookie cutter positions, be it either through a medical diagnosis or through a certain stage in the life course of the carer. There's some services that are only available for young carers that carers in their 40s and 50s might benefit from, and we found that sort of this recognition of the individual caring journey by services will be an important step. Flexibility of access to services, and a broader understanding of what constitutes respite, especially when it comes to respite at home, that the person that is being cared for stays in the home and the carer goes away, should be funded as well as other services. We had a big discussion around lived experience work as a way of carers to recover in the mental health space. But that, I think, was just the group, but more generally around embedding more lived experience in services, because that would be a solution to recognizing the individuality of caring roles and recognizing the impact that care has on the carer, and to bring that knowledge to services, how to better do that. Yeah, there was a lot more said, but I'll stop here.
Yep,
thank you very
fantastic.
much.
No, thanks for that. Again, lots of great insights there, and particularly that the comments around embedding that lived experience into some of the feedback and also into the design of services and supports for carers, importantly. So our final breakout room was room 4. So Jade's going to feedback.
Thank you. So our topic was how the term carer is used and defined. Quite a lot of our discussion was focusing on the sort of the varied terminology that is used and often interchangeably and sometimes being conflated. So carer, paid carer, informal carer, formal carer, and the ways that caregiver, that these kinds of terms are sometimes not just used in kind of common vernacular, but are also being sort of emerging in sort of the policy landscape, which just creates significant issues around trying to really isolate and identify carers and their needs, but also be able to really clarify what, for instance, government in particular is actually trying to accomplish for carers. As part of that, we sort of were discussing the ways that because of the issues that still surround just the term carer and its kind of complicated and varied usage, that it tends to silence carers, and that this is in some ways happening more and more within sort of the shift that's been occurring towards more kind of consumer-focused, consumer-driven models within the aged care and disability space. And part of the ways that we were talking about in terms of trying to address some of these issues was about trying to identify how we can sort of bolster carers' political and economic power. So to try and empower the kind of the people who are carers, about thinking, for instance, within the employment space, about whether we need people who are carers within those organizations to be able to sort of champion carers and carer rights. And also to be trying to think of, for instance, part of the issue we have is that carers as a political group are often essentially have limited political power. They're not able to go on strike. They're not able to, for instance, represent themselves in those particular shows of force. Other than that, we're also talking about how former carers in particular are a group that is often made invisible, and that the services that they're able to access is particularly limited, and trying to discuss ways that we might be able to sort of focus on that in terms of trying to support former carers being able to connect back with the employment landscape, to be able to upskill, engage in employment, and also be able to navigate, for instance, periods of bereavement in particular, given that there's limited payment for carer payment very, very short afterwards. So just a matter of weeks, essentially. So still trying to work out a bit more of the solutions, but definitely a rich discussion. So thank you very, very much, Group 4.
Great. Thanks, Jade. I mean, lots of very important points there, and lots of comments also coming up in the chat around empowerment for carers, in particular as part of that discussion. So, look, I think just very quickly, we've got one final question to engage you via Mentimeter. So just following on from the breakout room discussion, what's your #1 priority for carer policy in the next 12 months? So the options are there: carer health and wellbeing, economic participation, financial security, access to information and support, recognition, planning for the future. Okay, recognition's taking the lead now. And a couple extra coming up in the chat: access to information, support and recognition. So that just look, it gives us a bit of a flavour for the key issues. And I just think also just very quickly, if there's anything you weren't able to raise or discuss that you wanted to mention. So just any quick fire responses that people have a last opportunity to put up through Mentimeter. one of the comments in the chat is carer peer workforce as well. Carer payment. The responses are from all of our participants today. Yeah, great suggestion. Platform for carer skills to be matched to employers. Another comment on the carer peer workforce there. Yeah, and importantly, again, that point around former carers getting ready for employment with support. So I think that's been a really useful, starting point and discussion. The comments back through Mentimeter, but also the discussion. So thank you to all of the breakout room facilitators and to everyone who's contributed to this afternoon's engagement around a whole range of different issues, but obviously a whole lot of, very common themes in the feedback and in the chat this afternoon, which is fantastic. So the policy team will review all of the feedback provided and ensure that informs our ongoing systemic advocacy for carers in upcoming policy opportunities and submissions and everything else that we do. And a summary of the findings will also be included in the Research Incubator communique that we'll put out in a few weeks' time. So also just you can take a moment just to provide us some feedback on this afternoon's session via our short feedback survey. The link is being posted in the chat. And if you'd like to continue providing feedback to inform our policy work, there's a number of ways you can do that, which the team's also going to add into the chat. And in particular, I invite you to stay for the next and final Research Incubator session, which is going to focus on the Carer Knowledge Exchange and the many opportunities it's created for researchers, carers, policymakers and practitioners to share their knowledge and help connect research to practice. So we're going to now move to a 10-minute break. Hopefully I'm on time. I've lost my clock. Hopefully I'm on time, 10-minute break. Followed by session 2, which will be a panel discussion, which will start at 2:05. Where to next for the Carer Knowledge Exchange. So I'll see you there. Thank you so much for your participation in this session.